My name is Matty and I'm a kidney transplant.
Give us a general rundown of your medical history, Matty.
I was born with, or diagnosed with kidney disease, reflux nephropathy at age 3. Then had started dialysis at 12 and first transplant at 13 from my mother, and which lasted 11 years, and then back on dialysis at 25 for another 4 years. And then I was lucky enough to receive a second transplant, which is currently still going. Our first transplant was donated by my mother, so it was pre-arranged transplant. At the time, didn't really think much of it, just thought that was a normal thing that your mum does, give you a kidney, and everyone around me was telling me that life will get better from here than my previous 13 years. And which turned out to be the case 11 years before it went into rejection.
Do they take the first one out? Did they take your mother's out before you had the second one?
No, that's somewhere in my body still shrunk up to. They find it very hard to find it in an ultrasound or anything, so it's just shrinks up to pretty much nothing.
So you in effect have 4 kidneys now?
Yes, yeah. 3 very small ones. My second transplant was a totally different situation, obviously. Was on the waiting list, so I had to wait till someone had passed away and was an organ donor, and so it was after 4 years, just over 4 years on dialysis that time, so it was brought in a different lot of things to the situation, different emotional impacts, and I did receive the call. I sort of had to deal with the fact that the other side of the story, that another family was in mourning, that they'd lost someone they loved, and yet I was going to get their kidney to have another chance of a better quality of life, I guess.
Tell us a bit about the feelings you had at that stage and how you dealt with them.
My feelings were of like, should this be happening, and someone's died, and for me to be able to get off dialysis and live another life, a more quality one with my family and stuff. So I sort of dealt with that internally, and also speaking to other transplant recipients who were also getting transplants around the time, and also speaking to through Donate Life. I do some work with them, and I've spoken to a family who were a donor family, and they gave a slightly different side of the story on their side of it, which made it a lot easier to understand, and that the fact that they did lose someone, but they were grateful they were able to still contribute to help someone else live a more quality life. So that was how I was able to handle it.
How about the actual waiting, not knowing when you're going to get the call? Does that get you down a bit?
Well, I guess for terms on dialysis, the first 2 years you've got the hope that you're going to get the transplant, so this is only short term. And for me, it was after 2 years. I forgot about the transplant after that I didn't think it was going to happen, and it was just, how am I going to live my life on dialysis, and what changes do I need to make to be able to live healthy on dialysis and just survive. So when I did get that call, it came as a shock. So the call came, and it was Queen's birthday weekend, 4:30 Sunday morning, and I was staying at a mate's place, and so the phone rang, and the doctor's phone number came up on the screen, and I was thinking, well, who's ringing me? Why is he ringing me at 4:30 on a Sunday? And I've never heard from him for 4 years. And he basically just said, it looks like we've got a transplant for you, and do you want to accept it? And I saw a bit of a blur from there, but basically I said yes, and then he said you'll receive a call from the Brisbane hospital, and so which followed up straight away, and basically I had to get straight down to PA hospital to receive the transplant.
Take us through your recollections of the actual operation.
Other than when I first arrived to the PA hospital, I had to go through emergency and get a chest x-ray, and then straight up to the ward where they ran some more tests on just basically what medication they could use if the kidney went into rejection after the transplant. Then it was just a bit of a wait. I had to wait a couple of hours, and it was straight into theatre. Wheeled straight in and changed over to the beds, and that's when the memory got put to sleep, and woke up the next morning and the kidney was functioning, and I had to get out of bed for the first time to be weighed, and then the surgeons came in and basically said everything went well, and this is the medication that we're going to be prescribing, and so it was just sort of into recovery on that side, but on the other side also dealing with the emotional side after the transplant with the fact of the family and stuff as well. So.
How do you know when it's working?
It was outputting urine straight away, so it was going too well. It was just making plenty of urine, and they were always emptying the bags and stuff like that. So it was, and the blood results were coming down as well. I didn't really have a lot of pain. You have obviously tubes everywhere, and they're putting morphine in and stuff like that. But I had to lie on my back. It was you couldn't really go onto your side or anything. But very weak. When I got out of bed, I only had to probably walk. Wouldn't have even been half a metre, and I sort of collapsed straight back into bed and went to sleep again. So you're very weak after the procedure for the first couple of days. And but there wasn't a lot of. I didn't have a lot of pain. So.
Did you have a carer with you at this stage?
No. I've been on my own all the way through. Since I left home, basically.
No one at all?
No, I deal with everything myself. So, and friends and family who are in New Zealand and stuff like that, but I tend to keep things to myself and deal with myself and the hospital staff. So. I get on really well with the medical staff at Nambour Hospital, and I've learnt to understand all my blood results, and so I get a copy of them when I get my bloods, even if I don't have to see the doctor, and I can monitor from them on what I'm doing and how things are going. If I need to make any changes to diet or fluid intake, I can sort of gauge that as well. And then, so between me and my doctor, we work on how I feel and what levels I have symptoms and stuff like that. And if I show a symptom, then I know it's one level, so I tell them I think it's the tacrolimus is too high, I've got the shakes and we need to drop it, and he'll look at it and then suggest yes, no, or try this, and then so we work very closely together, and it's a partnership I believe for both sides to get through. I've had a few setbacks. I've had, after I came out of hospital, the initial transplant, I got quite a lot of infections through the medication. For the first 3 years. When I got back to the coast, Sunshine Coast, I was in hospital roughly every 3 months for 2 to 3 weeks, and they couldn't pick up what was wrong. And then I'd come right, and then it'd be about another 3 months, and I'd get sick again. And then in 2007, I went to the World Transplant Games in Thailand and picked up 2 types of salmonella, and came back to Nambour Hospital and got admitted, and picked up the norovirus as well when I was in, so I had 2 types of salmonella, norovirus, and 12 weeks in hospital all up, and I kept losing weight. I went from 58 kilos down to 45, and they couldn't understand why, so they started doing all these procedures, checking for cancer and stuff like that. So they did a colonoscopy, and they nipped the artery in the stomach and the bowel, and didn't realise I was internally bleeding, and got sent back to the ward, and then overnight deteriorated obviously, and they sent me straight back to theatre and ended up ICU on a ventilator, and basically fighting for my life. So the parents flew over from New Zealand, and the doctors told them that they believed the kidney had been lost. And it was just a matter of if I was going to pull through the whole thing, and before I came off the ventilator, so that's what they were just waiting to see. So, but lucky enough, the kidney kept fighting through, and it's bounced back to what it was after the transplant. So.
Do you think most of those infections you picked up were a result of the immunosuppressive drugs?
Yes. My doctor said it was because of my first transplant. Been on the medication that started to kill the bone marrow, and then starting up again, my bone marrow doesn't make enough now, and so now he runs everything down to a very low limit, and so for the last 2 years I haven't been in hospital once, and a combination of that, and I've started a new drug which started a trial, Intragram, which I've got to go in every 4 weeks and get it through IV. It's a drug that they normally give to cancer patients to lift the immune system. So between those changes we've made, then I haven't been in hospital once for 2 years. So. Going in and out of hospital while I was on dialysis, I was lucky enough it didn't interfere with work. It's only been post-transplant, I suppose, and I was lucky I had a good understanding boss at the time, and with my major setbacks I've actually I left work and started to do what I wanted to do, which was support other patients that have got kidney disease. So I've just been lucky to have a good under bosses, I suppose, who've been able to work with it and haven't put the pressure on me to make a decision early, health or work. So.
What advice would you give anyone else faced with a similar problem?
You've got to be strong and you have a good support group around you, be it family or the hospital. But you've just got to keep having that hope that things will come right. And it took 3 years for mine to come right, but it did come right. And I believe if you've got a good attitude and ride out the downs, the ups will come and make the most of the good times. So not try and dwell on the low ones. So.